Neff joining us. She is, I think, out of state somewhere, and through all the miracles that we're enjoying on Zoom now, we're going to be able to enjoy her talk today too. Dr. Neff is an associate professor of educational psychology at the University of Texas at Austin. She's a pioneer in the field of self-compassion research, conducting the first empirical studies on self-compassion more than 15 years ago. She has co-developed an empirically supported training program called Mindful Self-Compassion and is a best-selling author of a number of notable books, including Self-Compassion, The Proven Power of Being Kind to Yourself, and the Mindful Self-Compassion Workbook, which many of you might have seen, among other works. Her work can easily be accessed on Amazon, and I highly recommend checking out her list of publications. This past month and on our TCMS.com wellness pages, I posted a TED Talk that Dr. Neff did a few years ago, and it's a great watch also, so you can link to that on our website. For more information about Dr. Neff's work, you can go to www.selfcompassion.org. So at this point, I will turn over the program to Dr. Neff, who I don't see, but I guess she's there.
I'm here. Do you see me now?
There you are. Great. Thanks so much for being with us.
Good. Yeah, thank you. Thank you, Dr. Sayers. Yeah, I'm happy to be here. So I'm in Phoenix visiting my mother, but again, it was great that I could still work out to do this presentation. So, and I feel badly that I couldn't see all of Dr. Kim's talk. It's 8 o'clock in the morning here and I was sleeping, but it sounded like it was very similar to what I'm going to be talking about, which is self-compassion. So let me share my screen here. There we go. Okay, great. All right, so in particular, I'm going to be talking about, I'll talk a little more generally about what self-compassion is, but in particular, how self-compassion is so important for caregivers. All right. So what is self-compassion? So I certainly didn't come up with the term. I first learned about self-compassion over 20 years now. It was actually my last year of graduate school, finishing up my PhD at a University of California at Berkeley. And basically my life was a mess. I was a basket case. I had just gotten out of a divorce. It was a really messy divorce. I was kind of feeling a lot of shame and uncertainty about myself. And then also, you know, there was stress of finishing up my dissertation. And more than that, after devoting 7 years of my life for this dissertation, would I get a job? There were absolutely no guarantees. So yeah, I was feeling a lot of stress. And I was in Berkeley, you know, and they say, when in Rome, do as the Romans, which basically translates to, well, when in Berkeley, learn how to meditate, because Berkeley had a lot of meditation centers. And literally the street I lived on, at the corner of my street, was a little meditation center. And I had heard that, you know, mindfulness meditation was good to deal with stress. So I went to the course, and the very first night I went to this group to learn how to meditate, the woman leading the group talked about self-compassion. You know, she talked about how, although it's also important to have compassion for others, of course, and to develop compassion for others, that we also really need to explicitly develop compassion for ourselves, especially when we're suffering, when we're going through a hard time, that we can actually, she talked about how the fact that we can, you know, turn around toward ourselves and treat ourselves with the same compassion, support, and care that we would more normally show to others. And so I tried it, and I was really, quite honestly, blown away by the immediate difference it made. I mean, mindfulness meditation is also great, but it took a little time to master. But just the very act of stepping outside of myself and saying, wow, Kristin, you're really feeling a lot of stress. This is hard for you. You know, what can I do to help you? That caring attitude toward myself almost immediately changed my ability to cope with all the stress I was going through. So in many ways, you can think of self-compassion in its simplest form as just treating yourself like you would treat a good friend when they're struggling. And actually, I'd like you all to do a little thought experiment with me, if you will, or at least maybe it's not a thought experiment, but a little recollection. So I would like you just to think about, you can write this down if you want, or just think about it in your head. But I would invite you to think about some recent times when you've had a close friend come to you who was struggling, right? Maybe they were feeling badly about themselves, they were feeling ashamed of something they had done, or maybe they had made a big mistake, maybe a medical error, something like that, or having just a lot of painful conflicts, or maybe a relationship problem, or maybe something just like dealing with, the pandemic, the stress of the pandemic. So you can think of anything you want. But I would like you to think about when your friends come to you and they're struggling, especially when they're feeling badly about themselves. What types of things do you say to your friends, right? What are some of the, words you might use to your friends in that situation? Think about what's your tone of voice typically when you talk to a close friend who's struggling. And also, what's your body posture like? Do you do anything physically? Do you hold your body a certain way? Right, and just give yourself a few moments to think of that, recall some instances. Okay, and so now I'd invite you to think about the same question with yourself. So if you think about some recent times, either maybe you've been feeling badly about yourself, maybe ashamed of something you've done, maybe you made some big mistake, right, that you're feeling very badly about, maybe you aren't feeling as competent as you would like to feel, or just think about, how you've related to yourself when things are really stressful, like in the pandemic, right? Or relationship issues, or any really source of stress in your life. Think about what are the types of things you say to yourself when you're struggling, right? What language do you use? What's your tone of voice like with yourself, your internal tone of voice? And also, how do you hold your body when you relate to yourself when you're in distress, right? What is your body doing? And again, I'll just give you a few moments to think about this, or write it down if you're writing. Okay, and then now I would like you to consider what are the differences between how you treat your good friends and how you treat yourself when there's difficulty present, right? So you probably notice the types of words you say are different with yourself than your friends. The tone of voice is often much warmer and kinder to our friends than to ourselves. We often kind of maybe are kind of relaxed, and we may give our friend a hug. And with ourselves, we're often like very tense and strained. There's also other patterns of difference. For instance, with our friends, we often like see the larger situation. Well, this is why it happened. If you look at the larger context, right? And with ourselves, it's just like, I'm bad, right? We just blame ourselves. With our friends, we often remember, well, it's only temporary, this will pass. And with ourselves, it feels like it's permanent and forever. Or sometimes we tend to catastrophize with ourselves, and with our friends, it's not such a big deal, right? And so these are pretty stable patterns of difference for most people. Most people actually, what my research shows that about 80% of people treat other people significantly more kindly than they treat themselves. So this is actually the norm. So basically what self-compassion is trying to do is to turn that around so that we start to treat ourselves more like we treat our friends. Because let's face it, if we treated our friends like we treated ourselves, we would have no friends. Right? So really self-compassion is kind of making all this explicit and conscious, really noticing well, how am I relating to myself? What am I saying to myself? How am I saying this? Would I say this to a friend? Probably not. Okay, how would I speak to a friend? And then kind of use that as a model for how to relate to myself. And just that very act alone is incredibly powerful, because when we treat ourselves with kindness and support, we become much more emotionally resilient, which I'll talk about in just a moment. Okay, so that's the kind of easy way to think about what self-compassion is, but I do have a more formal theoretical model, which I needed to develop in order to develop a measure of self-compassion that we use in research. So when you really break down what goes into the mind state of self-compassion, there are really three components. So there's kindness that we just talked about, but mindfulness and a sense of common humanity is also key. So let me just talk a little bit more thoroughly about each of these. So we've all heard about mindfulness, right? Mindfulness is ubiquitous in society now. And mindfulness is actually at the core of self-compassion. You can't be self-compassionate if you aren't mindful, right? So mindfulness, as we know, is being aware of what's occurring in the present moment in a kind of accepting way, not turning away from things, not avoiding them, but also not over-identifying with them so that we're completely lost in the drama of it. Mindfulness allows us to step back a little bit, be a little bit objective or have some perspective and say, okay, this is what's occurring. And even when it's painful, being willing to be present with what's occurring. Now, if we aren't present with our own pain, either if we just kind of stuff it down, I'm not going to look at it, I'm not going to go there, I don't have time to look at that, well, then there's no opportunity to give ourselves compassion. Alternatively, if we're lost in reactivity, like, oh my God, this is the worst thing ever, and we're just kind of, we have no perspective whatsoever, then we also can't step outside of ourselves to give ourselves compassion. So we need some mindfulness in order to kind of start the process of compassion. And then once we do that, you know, we're able to be kind to ourselves. Now, we aren't always kind to ourselves. Sometimes, often when we notice our pain, we're cold or we're judgmental. But what makes it a self-compassionate response is that we're kind and supportive to ourselves. And it's important to note that this type of self-kindness, in psychology, most people define compassion not so much as an emotion, but as a motivation. It's the motivation to alleviate suffering, which of course you all know about being physicians, right? And so when we turn toward ourselves and we notice that we're struggling in some way, this motivation arises to help ourselves in some way, to help alleviate our own suffering, as opposed to being judgmental, which is the more common response. But this is really important. And what also needs to occur in a self-compassionate mind state is an understanding of common humanity, realizing that suffering is actually part of the shared human condition. I mean, if you break down the Latin of the word compassion, you know, passion means suffering, but cum means with. There's a sense of suffering with someone else, which actually differentiates compassion from pity. So when you pity someone, you look down on them. When you have compassion for someone, you kind of relate to them. Oh, I see, I've been there as well. And the same thing with self-compassion. You know, self-pity is not very helpful. Self-pity is, woe is me, this, you know, poor me. Self-compassion is saying, well, everyone's imperfect and everyone lives an imperfect life, right? Everyone makes mistakes. Everyone gets old and dies. You know, I mean, some people suffer more than others, and that can't be discounted. But nonetheless, kind of a shared feature of the human condition is suffering and imperfection. And what this does, the reason this is so powerful is because, you know, although we know this logically, more often than not emotionally, especially like if we make a mistake or, you know, something really difficult happens, normally our response is, this isn't supposed to be happening. Something has gone wrong, right? As if what's supposed to be happening is perfection, right? That's the norm, that somehow, you know, again, this isn't rational, but emotionally, everyone else in the world is living a normal, perfect life, and it's just me who's blown it, or it's just me who's made a mistake, or it's just me who's struggling in this way. And when we do that, we start to feel isolated from our fellow humans in our suffering, which just adds insult to injury, because not only are we struggling, we feel isolated in our struggles. And as we know, feelings of loneliness and isolation are very psychologically damaging. Let me just tell you a little brief story of how I saw this play out in my life, self-compassion, and especially, you know, self-compassion versus self-pity. So my son is autistic, and he's doing great now, by the way. He's 18 and he's driving and he's doing fabulous. But when he was little, you know, he was very autistic. He was much more withdrawn. And I remember one time being at the park with him. He was maybe about 4 or 5. And it was a beautiful day, and, you know, all these parents were there with their kids, and the kids were interacting, playing games, and they were interacting with their parents. And here's little Rowan, you know, on the slide. He was just stimming, you know, doing the self-stimulatory behavior, banging the slide, engrossed in the sound, completely not engaging with me or any other child. You know, and I'll admit it, I started to go down that rabbit hole of self-pity. You know, why me? You know, why can't I have a normal, unproblematic relationship with my child like all these other parents here? You know, I started feeling sorry for myself, you know, which is only natural. But luckily, I caught myself because I had been practicing self-compassion, and I said, wait a second, Kristin, really? You're assuming that all these parents have and will continue to have an unproblematic relationship with their child? You know, maybe it's not autism, but surely some of these other kids, you know, will have other mental health issues or maybe physical challenges, or at the very least, all of these parents will have conflicts and difficulties in their relationship with their children, because that's actually what it means to be a parent. Being a parent is not about having everything go perfectly. Being a parent is like struggling, making mistakes, having challenges, loving our children the best we can, you know, and just getting through. And once I made that reframe, you know, yeah, okay, maybe it's not autism, but it's surely something. Then I went from feeling isolated on that playground to feeling so connected to all these other parents in this kind of shared journey of, you know, challenging parenthood. And so this is really one of the big differences that self-compassion can make, and also what makes it so different than self-pity. It's not woe is me, it's just recognizing, hey, you know, this is difficult for everyone. Okay, I also want to point out that there is 2 different sides of self-compassion that sometimes people don't realize. I like to call it the yin and the yang of self-compassion. And, you know, so most of you are familiar with the symbol of yin and yang. And so yin energy is kind of more of a soft, nurturing energy. Yang energy is more of like a hard, powerful, forceful energy. But the idea is all things have both energies, and they need to be balanced and integrated. So self-compassion also has a yin side and a yang side. So the yin side of compassion in general, but in this case, self-compassion, is what allows us to be with ourselves in a compassionate way, just to accept ourselves, to accept the fact that it's hard, to accept our own imperfection. It's more of a nurturing energy toward ourselves. You know, we comfort ourselves, we soothe ourselves, we reassure ourselves we aren't alone, we validate our pain, you know, this is really hard, and we can be with it as it is. And this is the real healing aspect of self-compassion. It's almost like a motherly energy, a tender energy that actually allows us to heal. But, you know, if you're a firefighter and you see people about to be engulfed by flames and a building on fire, you don't say, hey, I'm here for you, I really feel your pain, right? No, you jump in that building and you pull the people out of danger, risking your life, right? And so to alleviate suffering, often we have to take action. We have to do something to alleviate suffering. And so an important side of self-compassion is acting in the world. And this might mean protecting ourselves, like saying no, drawing boundaries, right? I actually think of like the Me Too movement or the Black Lives Matter movement as like self-compassion movements. They're like the arising of this young, no, you cannot do this to me. I need to protect myself. That's an act of self-compassion. Also providing for our needs, right? Often we're just always saying yes to others, and we're just always giving and giving and giving. And we don't take the actions necessary to meet our own needs, to fulfill ourselves. Sometimes we need to say no to others and say yes to ourselves in order to care for ourselves. And then also motivation. A lot of people get this wrong. They think self-compassion is just about self-acceptance. But if you're engaged in a behavior that's unhealthy, or you're in a situation that's really harming you in some way, or is not, making you unhappy, it's not compassionate to accept the situation. It's compassionate to try to change the situation. So to try to change your behaviors, or to try to maybe change your job or whatever you need to do. The difference is the motivation for the change doesn't come from feeling like you're inadequate or you're a bad person. The motivation for the change comes from a sense of care. I want you to make a change because I care about you and I don't want you to suffer. And it's actually more effective. Let's see, how am I on time? I think I'm okay. All right. Just very briefly, I won't go into this. If any of you are interested in the research on self-compassion, there's over 3,000 studies right now. These are studies with self-compassion in the title. It's exploding. If you go to my website, selfcompassion.org, I have many of the original PDFs on my website. And just to just for those of you who are scientists, and of course many of you are, just to know how do we even do research on self-compassion? There's three main methods. One is by taking a self-report, the scale I developed to measure self-compassion. You can actually fill that out on my website if you're curious. So we correlate self-compassion scores with other outcomes. Another common one is mood inductions. We have people write to themselves with mindfulness, common humanity, and kindness, and sees how that changes their behavior in the lab. And then more and more, we're doing intervention studies, like they might take the Mindful Self-Compassion program, which we developed, and to see how that changes behavior. And so the bottom line is self-compassion is very powerfully linked to well-being. It's a link to reductions in all sorts of negative states like shame, perfectionism, depression, anxiety, suicidal ideation, very important. But it's also linked to increases in positive states of mind, things like happiness, gratitude, hope, optimism. And that's because, self-compassion is aimed at suffering, but the feeling of compassion itself is actually a positive feeling. It feels good to feel connected, right? And to feel kind. And so it actually simultaneously reduces the negative and increases the positive. Since you're doctors, I had to throw this in. Self-compassion is also linked to physical well-being because, of course, there's a mind-body connection. So what self-compassion does is it decreases sympathetic response, things like cortisol, which tend to be generated when we're very self-critical. So it decreases this response. It increases parasympathetic response, things like heart rate variability, because when we feel safe and we're almost like reparenting ourselves, when we give ourselves compassion, and that activates the caregiving system, the parasympathetic system. It's linked to better immune response to social stressors, better sleep quality, and lower physical symptoms. So it's good for mental and physical health. And so again, this is a complex topic and I don't have time to go into it, but a lot of the common misgivings we have about self-compassion, the research has proved completely false. People think self-compassion is going to make them weak. Quite the opposite. Self-compassion is one of the most powerful sources of coping and resilience we have available to us. For instance, soldiers who come back from combat who are more self-compassionate, they're less likely to develop PTSD. People think it's selfish to focus on giving yourself kindness. Quite the opposite. The more you give yourself kindness, the more you have available to give to others. So it's linked to better relationship interactions, more compassion for others. People are afraid it's self-indulgent, this kind of yin. It's just like, oh, I'm just gonna eat cupcakes all day. No, if you care about yourself, you're gonna do the things you need to be healthy. So, people visit the doctor more often, they practice safe sex, they exercise, they eat right. And then the big misgiving that people think it's gonna make them slack off or be less motivated, want to achieve less, just the opposite. Self-criticism, yeah, it kind of works as a motivator. I'm sure it got many of you through med school, but it has all these unintended consequences like performance anxiety, fear of failure. Shame is not exactly the best get up and go mind state, right? So self-compassion, this motivation out of care, is actually more effective, it's more sustainable, it's linked to less fear of failure, and more likely to pick yourself up and try again. Okay. So now let me get to, we'll have questions at the end. You can ask me about this, but I don't want to miss this portion of it because it's so important, especially for, you know, healthcare providers that are just under so much stress right now. Is self-compassion useful when caring for others? Absolutely, right? I can tell you as an autism parent, right? As any parent can tell you, but especially as the parent of a special needs kid, I don't know how I would have gotten through without my self-compassion practice. Self-compassion gives you strength and resilience when in difficult caregiving interactions, and also allows you to be a better caregiver. But let me break it down a little more for you. So first of all, there's a lot of research on self-compassion for healthcare professionals. And what we find is that it's linked to less burnout. Professionals who are, you know, more compassionate, they're less likely to burn out. They're less likely to feel exhausted by their profession. They're less likely to depersonalize, you know, which happens after a while when you just kind of start tuning out and becoming less personal. That's less likely to happen. And it's linked to more satisfaction with caregiving roles. And so we know this, again, not only from self-report research. If you look at correlations with the self-compassion scale, for instance, it's linked to very positive outcomes for healthcare professionals. But recently we developed something, a self-compassion training program, a brief program, a 6-week, 1-hour-a-week training program that we actually developed at Dell Children's Hospital in Austin. And we did research on this. We just published this. It's available on my website if you're interested. But it shows that it really helped the healthcare professionals at Dell Children's. They were more compassionate to themselves. They were more compassionate to others. They were more mindful. They were less stressed. They were less depressed. They experienced less compassion, less burnout, less depersonalization, and increased compassion satisfaction. So we had really good results, and they're still teaching this program. And maybe at the end I can talk about it more. We're starting to teach this online at the Center for Mindful Self-Compassion. So we know it works. Okay, how does it work? Why does it work? Okay, so first of all, I need to distinguish between compassion and empathy, which is really important to understand what happens for caregivers. So compassion, as I mentioned, is concern with the alleviation of suffering. We're generating feelings of kindness, also we're being mindful, being willing to be with pain, and a connectedness as we experience someone's suffering. And that's the same whether that compassion is aimed outward or inward. Empathy, on the other hand, is a process of emotional resonance, right? So we know that our brains evolved to have the capacity for pre-verbal empathy. So, you know, if the first 2 years of life before children develop language, parents and babies primarily communicate through this process of emotional resonance. And parents who are very attuned to their children's emotions, I think evolutionarily, they were more likely to pass their genes on to future generations. And so the brain, this little argument about whether they're actual mirror neurons and humans, we know that monkeys have them, but nonetheless, a huge portion of the real estate of the human brain is devoted toward resonating with the emotions of others, because that allowed us to cooperate and survive and pass our genes down. So empathy and compassion are not the same thing. For instance, some con men had very good empathy skills. They're very sensitive to, you know, picking up on the emotions of others, but they don't use that to care about the suffering of others. They might use that to actually, you know, rip off their target at that point. So resonating with others' pain does not necessarily mean you care about others' pain. So compassion, there is some empathy, the ability to feel what others are feeling, that allows you to be mindful of their suffering, but there's also a sense of connectedness with that suffering and caring for that suffering. Okay, so what happens with empathy for caregivers? And by the way, caregivers, people who go into caregiving professions are typically very empathic. That's partly why they go into these professions, because they tend to be sensitive, empathic people. So what happens if day after day you're resonating with others' pain and suffering, right? So when you're seeing someone in pain, the pain centers of your brain, we know in fMRIs, the pain centers of your brain are also activated, you know, not as intensely, but they're still buzzing with the pain of others. Day after day, what that could lead to is secondary traumatic stress, right? So if you're around people experiencing trauma, you can also experience trauma yourself in a secondary manner, to the point, especially over time, you know, which happens with professionals, that it helps contribute to burnout and people just they just completely get full and they just shut down, right? And I don't need to explain burnout to you, you all know what it is, but it's kind of feelings of exhaustion. With secondary traumatic stress, you can even get some PTSD symptoms like trouble sleeping, difficulty focusing, you know, other types of traumatic symptoms. Okay, and so as opposed to empathy, which can lead to burnout and secondary traumatic stress, compassion is actually a rewarding and energizing experience. The experience of compassion actually activates the reward centers of the brain. It feels good when we're able to connect with someone else's pain, and instead of just going into like empathic distress, are actually able to experience compassion. So in the field, I don't know if you're aware of this, but hopefully you will be now, we've moved away from calling it compassion fatigue. It's not compassion fatigue. Compassion is not fatiguing. Compassion is energizing and rewarding. It's empathy fatigue, right? If we just have empathy and it's not balanced, it's not buffered with compassion or some other resource, empathy can be draining, right? Okay, and so how does self-compassion come into this? Especially, actually, before I get there, I wanted to ask, or kind of rhetorically, you know, how do we prevent burnout, and what role does compassion have in preventing burnout? Well, so you all know there's two main ways that professionals are advised to prevent burnout. One, to kind of deal with this empathic resonance, is emotional detachment, right? Emotional detachment is necessary. You know, so at Dell Children's Hospital, in speaking with, you know, the doctors and nurses there, I mean, you can't like be totally overwhelmed by someone's pain, lost in it, and then go to the next room and have to like deal with another patient. You can't carry over the emotions of one caregiving situation to another, because that prevents you from doing your job. So you need to be able to compartmentalize and detach somewhat. It's necessary. However, if you are only detached, and you're detached too much, and you actually never process the pain that you've just resonated with, that's when it starts to lead to things like burnout and depersonalization. And also, as you know, I'm not an expert in this field, but one of the problems, especially for doctors or nurses or caregivers, is if you're too detached and you're not sensitive, you aren't picking up, you aren't empathic about the person's pain or the person you're caring for, you're going to be actually less accurate at diagnosing that patient. You may be a less skilled caregiver if you're too emotionally detached. So emotional detachment is necessary, but if you have too much of it, it can be problematic. The other big advice is self-care. And self-care is part of self-compassion. People who are more self-compassionate, they tend to engage in more self-care activities. So, you know, things like getting massages, talking to friends, debriefing, eating well, doing yoga. Self-care is great. There's really no downside to self-care. And again, you know, more self-compassion leads to more self-care. But there's one major limitation of self-care in an actual caregiving interaction, which is like if you're with a patient and they're experiencing a lot of trauma and your brain is buzzing with their pain and their trauma, you can't say like, whoa, this is freaking me out, man. I'm gonna go do yoga. See you later, right? So self-care helps you off the job, it helps you before the job and maybe after the job, but it doesn't help you in the moment of empathic resonance with the patient's pain, right? It doesn't help in that moment to buffer the overwhelming effects of being with and feeling the patient's pain. Okay, so it's not a downside, but it's a limitation of it. Self-compassion, on the other hand, is what actually allows us to be with our own empathic pain in the moment of caregiving in a way that provides a buffer for us so that we aren't overwhelmed, right? They always show this, to put on your own oxygen mask before helping others, and they use that to refer to self-care. But if you think about it, it's like saying, put on your oxygen mask before the plane goes down or after the plane has crashed. We need to put our oxygen mask on as the plane is going down, which means as we are emotionally resonating with the pain of patients, right? And so what does that look like? That might look like checking in with yourself and realizing this is so hard, this is so overwhelming, you know, kind of, you know, talking to yourself like a supportive friend, you know, I understand, I'm here for you, you know, as opposed to judging ourselves or just being cold to ourselves or ignoring our pain. It might mean just kind of being present with our own pain. And by the way, so if you, the healthcare workers at Dell Children's, they could do a little bit of it, you know, right with the patient. Sometimes they had like in the moments, literally between walking from room to room, that's when they would give themselves compassion, because they almost didn't have any extra working memory units, you know, when they're with the patient. But walking from room to room, they might put their hand on their heart and say, whoa, that was really hard, you know, okay, it's okay, you know, and then just kind of that little bit of support gave them strength to keep on going throughout their day. And then also afterwards, when they're off the job, you can also practice self-compassion. It also helps off the job as well, but it's something you can do on the job. And what was really cool at Dell Children's is they started having a culture of self-compassion. So like one nurse would look at another, like in a really difficult situation, and would give like some little sign, like remember to be self-compassionate. So they would help each other be self-compassionate, which increased their compassion for each other as well in a way that was really powerful. Okay, and here's the really cool thing about self-compassion and how it interacts with empathic resonance is that empathic resonance goes two ways, right? So the more we're able to calm and soothe and care for ourselves when we're struggling and we're stressed, actually our patients pick up on that, or you know, the people we're with pick up on that. And remember, this skill is pre-verbal. So of course you don't show it, and you've got professional demeanor and you aren't saying anything that lets patients know that you're distressed. But at some level, their mirror neurons are able to pick up, and maybe even very subtly, on your internal mind state. So if you walk into a room or you deal with a patient and inside you're feeling your own loving connected presence for your own pain, this actually helps them as well. And so I'll just tell you a little story again. So do I have a, no, I didn't. Okay. I'll tell you a little story again of how I saw this impact me with Rowan again. So Rowan, actually, autistic children have a lot of empathic resonance. They're horrible at perspective taking, right? They can't really think in other people's shoes, but they're very sensitive, which is part of the reason they shut down. They're almost too sensitive. So he was like a mirror to me. And I remember, so when he would have really horrible tantrums when he was young, and, you know, of course, sometimes I would get frustrated or, you know, feeling like I was inadequate or something like that. I noticed that when I reacted to his tantrums in a way that wasn't self-compassionate, his tantrums would ramp up. But when I could remember to be self-compassionate, his tantrums would calm down. I remember once, actually it was on a plane, believe it or not, it actually was on a plane, and he threw this doozy of a tantrum. It was a transatlantic flight, and you know, it was that time when everyone was trying to get some sleep, and the cabin crew turned the lights down, and for some reason that set him off, went into this huge tantrum. You know, I didn't know what my options were, so I thought, oh, I know, I have a great idea. I'll take him to the toilet where he can scream in there. Maybe that will muffle his cries. You know, and we get to the toilet, which is of course occupied. You know, the lesson life had for me in that moment was not how to escape a situation. It was like how to get through it. So I just resorted to my self-compassion practice. You know, I made sure he was safe, but I just like flooded myself with compassion. Usually I do it kind of on the sly, but I didn't care. It was such a desperate situation. I was like holding my hands on my heart, and I was saying, it's going to be okay, Kristin, I'm here for you. You know, I'm so sorry. This is so hard. And the moment I did that, then he started to calm down. And then I could actually start to soothe and comfort him. So, you know, we're always interacting with others' emotions. And it just makes a big difference, not only for ourselves, but for those we care for. Let's see, I think I've got, let me just check in. I was gonna do a self-compassion break. I'm gonna stop the share anyway. Brian, do I have time to teach the self-compassion break, or do you want to go straight to questions?
No, it's fine. We're doing great with time, so go ahead.
How much time do we have left?
You know, maybe 10 minutes.
Okay, I'll do a fairly quick self-compassion break because I want to give you guys a tool you can use. There is a practice, it's too complicated to do here. There's a practice I developed called self-compassion for caregivers that's designed to be used like at the bedside. And if you go to my website under meditations, it's not a meditation, it's like a 7-minute practice. It's on YouTube, you can read that. But I just very quickly want to give you something, a tool you can use like when you leave today called the self-compassion break, which is just a way to intentionally call in the 3 components of self-compassion when you're struggling. And so you don't have to close your eyes. I'm going to close my eyes. It helps me to sink in. So you may want to close your eyes just to kind of get more into the experience. Okay, so maybe just taking a moment. That was a lot of talking just to settle into your body. Right. Now, in real life, you would just do this whenever you're struggling, but since we're kind of changing hats here, we're just going to take a moment to settle in. Okay, and so I'd like you to think about something in your life right now that is a struggle. Please don't think of something overwhelming. That's actually going to be harder to learn the practice if you're overwhelmed. But something right now that's that you're struggling with, you know, probably don't go for COVID, maybe too big, something smaller, some frustration in your life, or maybe a sadness or a relationship struggle. Right, and just choose one thing to work with, something that's been troubling you. Right, so just call the situation to mind. And so first, you know, we want to bring in some mindfulness. So you might try saying to yourself something like, you know, this is really hard. What I'm going through right now, that this is tough, right? Or maybe this is a moment of suffering or struggle. We're just bringing mindfulness to the fact. We're bringing mindfulness to our pain. We aren't lost in it, but we aren't ignoring it. This is, we're validating it. This is hard. Okay, and then also remembering the shared nature of struggle, you know, struggle, difficulties. This is part of being human, right? Nothing's abnormal about this. I'm not alone. There are many people going through similar struggles. Some less, some more, but you know, we're all struggling. It's not just me. Nothing's wrong with me for struggling. This is part of being human. And then we want to see if we can give ourselves a little kindness. So you might, if you want, you can put your hands on your heart or hold your hand or some physical touch. You don't have to, but it can help actually activate the parasympathetic nervous system. So why not? You know, put your hands on your body in some way. And we want to give ourselves kindness. So maybe thinking of the more usual way we do it. I'd invite you to imagine you had a close friend who was having the exact same experience you're having, you know, had the exact same situation in their life that you're having. Right? And imagining what would you say to your friend? How would you say it? What tone of voice would you use? And then just try saying this to yourself. You know, you aren't lying to yourself. It's not like positive thinking, but just see if you can say some words of concern. I'm so sorry. You know, I'm so sorry this is so hard. Is there anything I can do to help in this moment? And then just see how that feels. Okay, and then you can open your eyes. And again, this is also on my website if you want to do a kind of longer version. It's called the Self-Compassion Break. This is one of the most popular one in our healthcare program at Dell Children's, because people, you need to have a break at least to get something to drink or go to the snack machine. So people would also do the Self-Compassion Break. It's kind of like setting the reset button on your computer. If you're feeling really distressed, just remembering mindfulness. This is hard. Common humanity. I'm not alone. This is normal. This is part of being human. And then some words of kindness. It can really make a big difference.